Welcome to Anti-Aging Unraveled with Dr. Lori Gerber. The body is one of the most complicated systems in the universe. Dr. Gerber and her guests explore integrative medicine and cosmetic dermatology, combining traditional medicine, alternative health practices, new innovations, and technology which work together to help you look and feel natural and age gracefully. Now, here is your host, Dr. Lori Gerber.
Good evening, everybody, and welcome to another episode of Anti-Aging Unraveled. It's a really exciting one for me. I've been looking forward to this night for a while, not to mention it's the night before vacation for me, but I'm really happy to have an expert in the field that I'm super interested in, and it's a supplement that it's actually a line that I love, to be honest. I'm going to start with, it's called Biocidin, and it is by far one of the things that's actually changed my life as a chronic Lyme sufferer as a couple of years ago. And this product and the product line has actually really changed the way I started practicing with my chronically sick or ill patients. So I have a specialist in the field, and her name is Alia Khan-Elhady, and she has a lot of alphabets after her name: MSW, RSW, FNTP, and I'm just going to call her lead clinical consultant for Biocidin because that's easier. But we'll find out what all those letters mean, I promise. And if you guys have any questions tonight, and I know that a lot of people did respond on Instagram and Facebook that they were going to be listening tonight. So if anybody has questions, I am going to keep trying to check over to the Instagram Messenger as well as Facebook Messenger and my email as well. So I will try to get them answered. If not, we will answer them afterwards online. I'll be more than happy to just reply back to everybody. And if I have questions, I'll ask Alia and get everyone answers. So without relaying this anymore, Alia, welcome.
Thank you. I'm very excited to be here with you. I did not know that you were using it as a chronic Lyme patient. So excellent. I'm excited to have this conversation with you.
Yeah. So I will give you that whole story soon too. So and actually, a lot of my patients are not familiar with that part of my story. That happened a couple of years ago. It hasn't been that long in my history. So let's get down to a little bit of basics. So first of all, you're in Canada, right? So welcome from the other side of the border that we still can't get to.
I know.
Very upsetting. But so how did you basically come across this company? How did you start with them? How long ago were you there? All that kind of stuff.
Yeah, so I actually have a little bit of a different background. I didn't start off in the field of functional medicine, although I always practiced in a holistic manner. So my alphabet soup, that MSW is Masters of Social Work. So I'm actually a social worker with a clinical lens. I practiced that for well over 15 years, and a lot of addiction, mental health. And I loved doing that work, but I actually got sick. And I got sick and I kept seeing practitioners and more of, our allopathic medicine, because that's what was available to me. And that's what I knew at that time. I got sick. I lost the function of my hands because I was so inflamed and nobody could figure out what it was. And that went on for about a year, almost two. And I actually met Dr. Fresco. She's the owner of the line. She's developed the full line. Her and I met through mutual friend through, it was a yoga practice. We went to a yoga retreat. And that's probably when I was almost at my worst. And we just started talking about Biocidin. I didn't know anything about it. And I thought, well, I'll give this a shot. And so I started taking the drops, and I was working on some dysbiosis that I had in my gut. And lo and behold, I started to see the function of my hands come back. And it was really important for me to kind of understand more about that. How could I support my body so that I could continue to have optimal health? Because for you, this might be a similar case. Recovery is an ebb and flow. So I never am in a place where I'm like, I'm good. I think you always need to work on your health. So then I went back to school and I studied nutrition, because to me, the building blocks are what we eat. So that FNTP is functional nutritional therapy practitioner. So now I combine the two worlds together. And I use my clinical lens with the social worker as a licensed healthcare professional. And then I bring in the nutrition as well. And then after I met Dr. Fresco, that was actually a handful of years ago. That was closer probably to 2017, 2018 or so. They asked me to come along, and I wasn't ready to make the leap yet. And then in 2019, I went over to Biocidin as a clinical consultant. And today I'm their lead clinical consultant. I love the company. They have got such good energy. And I really enjoy being able to speak to other practitioners and clients out there and educate them on botanicals, because they play such a large role in a lot of people's healing journeys.
Yeah, that's so important to explain. This is botanicals, so that everybody understands most of all the ingredients for the most part are our natural botanicals, and the way that you guys blend them together is so crucial. And it's just something you don't find in any other lines. And I will tell you, I've searched high and low, so I can speak again from experience that there's nothing out there like this. So do you know how this started? How did they come up with I guess, did someone get sick in the company? How did they start producing this line?
Yeah, so Dr. Fresco designed this line in the late 80s, so well over 30 years ago. It's been around the block for quite some time. It came out of a need. She initially, when she graduated from traditional Chinese medicine, she was practicing holistic veterinarian practice because she loves animals. So she was actually working with dogs and horses, and I think she had some other animals in there as well. And she got exposed to some herbs outside of Chinese medicine. So she had her traditional background with Chinese medicine. And then while working with this holistic vet, she got exposed to some other botanicals. And so she was addressing these really difficult to treat infections with these animals. And some practitioners in the San Francisco Bay Area actually approached her asking her if she had something similar for humans. And she didn't at the time. But of course, she went out on her way and she went and revamped that formula. And she gave it out to these practitioners. So it wasn't actually a full-on line at that point. It wasn't even named Biocidin. We didn't have biobotanical research behind us. These practitioners were essentially using it on a handful of their patient population that had HIV. So they were using it to suppress pathogen load, increase immune health, right? And they liked what they saw. Unbeknownst to Dr. Fresco, one of those doctors actually sent the bottle off to Great Smoky Labs, which is now Genova Diagnostics. Mm-hmm. And because Rachel had no idea that this bottle was being sent off, she was quite alarmed when she actually received a phone call from the director there. And Dr. Lee at that time had called her asking her what was in the formula because it's killing everything. She said, "Is that a good thing?" And he reassured her it was an excellent thing. It came out being one of the most highly sensitive substances that they had put on their panel. And to this day, I've known they've at least run over 250,000 comprehensive diagnostic stool analyses. So they've been able to see how sensitive it is to all types of different organisms.
Yeah, so that was what got me, to be honest. I love the data. So, when you see this killing everything on every petri dish, right? It's performing better than 95% of the antibiotics for the most part for a lot of this. And I did read a lot of those results as well, especially early on. That's amazing. So the ingredients that are mixed together for Biocidin specifically, and we can talk about some of the other products, are so well developed and designed to work synergistically to be bacteriostatic and bactericidal, right? So, and I promise I'll get to my story at some point, but I swear I'll get there, guys. So I just want to make sure we get the main points in, then I'll tell you my stuff. So I'm going to just read the ingredients because I think that a lot of people need to understand where some of these things are coming from. So a lot of people have heard of bilberry. I think bilberry, especially with COVID, has been all over, everywhere, to be honest. Noni extract, milk thistle, echinacea, the two types of echinacea, purpurea, and I can never say angustifolia, golden seal, shiitake, white willow bark, garlic, grapeseed extract, black walnut, the hull end leaf, which is actually important, raspberry, fumitory, gentian, tea tree oil, galbanum oil, lavender oil, and oregano oil. So again, a lot of these we've heard of, right? Most of these, I think most people that are into natural stuff have heard of these things. And they take them like separately, right? You're taking one, you're taking another. You might take milk thistle or grapeseed separate. But the key, again, that I think is putting these together and how novel it is for chronic inflammation, chronic infection. And in my case, it was Lyme that was very resistant to treatment. So, what I guess the question that I would start with, maybe we'll start with gut, because I think that's probably, you said you were working on your gut health. And I think that's something that a lot of docs miss with this line, that it is so good for gut health. And then we'll kind of maybe transform into the chronic infections and bugs. But so how does it work? So what is it about this that actually makes it help the GI tract? And when we say help, just for you listeners out there, if you haven't listened to my podcast, we love talking about leaky gut, which is my least favorite term in the world, but dysbiosis is a good term. How about we just say inflammation of the gut lining that leads to immune dysfunction? So how does this product help that?
Well, in a number of ways. So
a lot of them, right?
Yeah, you read off the ingredients. So there's 18 ingredients in there. 14 herbal extracts, and 4 essential oils. So one of the things you pointed on was synergistic. So you can take oregano oil, for example, and it is a great antimicrobial, but it's not very selective with what it goes after. So it will actually decimate the microbiome. So you might actually increase your dysbiosis. It could look better at first, but because you've created so much space for other pathogenic or even opportunistic commensal bacteria to grow out of disproportion. So you might be doing a disservice down the road to your gut. So the key here is the synergy. There are micro amounts of these botanicals that are working off of each other. So some are antimicrobial. As you mentioned, there's bacterial static, bactericidal. So we've got some botanicals in there that are slowing down the replication of organisms, some that are actually killing them. Another huge key part that a lot of people forget about when they're dealing with any type of dysbiosis is what happens if those organisms have created a biofilm. And oftentimes they do. So 80% of microbial infections will create a biofilm in as little as 2 weeks, right? And so if you are going at these overgrowths with an antimicrobial or an antibiotic even, if they can't penetrate through the biofilm, you are not going to get the organisms hidden behind that. It's almost like an invisibility cloak. So think of it like a force field where your immune system isn't recognizing what's going on beneath there. And so these botanicals aren't going to penetrate in there. With Biocidin, we've obviously layered in different botanicals that are also going to disrupt and dismantle biofilms and prevent them from regrowing because they come back very quickly. So the initial formula, which is Biocidin liquid, that's the one that was created out of the need from the physicians that asked for it. That was our first formula. And that one really is our go-to anytime we want to support GI health. It's best used because it's going to coat the mouth and the esophagus and then get into the gut in a nice concentrated format. One other thing to think about is if we're looking at dysbiosis, we have a huge long tube in our body. So our mouth, all the way to our anus, right? So our mouth will have organisms that can translocate into our gut. So we want to address those as well. That's why I really love using the liquid. We do have Biocidin that comes in a capsule, but my preference is the liquid Biocidin anytime we're trying to address GI health. So we're going to bring down and balance the microbiome. We're going to start to see short chain fatty acids increase. And that's going to help with tightening up our tight junctions, right? Increasing that. And we're going to start to see also through the botanicals, but also through balancing out the dysbiosis, we're going to have an anti-inflammatory effect. So we're going to bring down that inflammation as well. There's so many different things that are going to happen when you start to rebalance that microbiome. You're also going to see I don't want to go off on a tangent because I could talk for an hour about the liver, but we're also going to see a decrease in liver damage potentially because when we have something called gram-negative bacteria in our gut or even systemic, the outer coating of gram-negative bacteria releases lipopolysaccharides. Those are very damaging to the liver. So we're going to start to see all of these things start to balance out as we are addressing any type of overgrowth that's affecting the body.
So I actually just got a question, and it goes along those lines, and it was, how do we check that it's working, right? So, if you're doing this for gut health, besides obviously symptomatology, right? And I think that's a little bit of a tough question, but because sometimes we don't get the labs, they end up coming to me, and we don't get some of these inflammatory labs. I just treat based on symptomatology, but I do see CRPs go down. I do see a lot of, I actually even, believe it or not, lipid panels, I believe get better when we start using these, especially from a HDL to LDL ratio. I've seen a lot of that. And in all honesty, if I, with a company that's very reliable for bug testing, if you will, or microbe testing, I do see my levels go down, my IgGs, my IgMs, they'll decrease. And I know a lot of docs don't like to monitor necessarily levels over time. But I've done this. I've done the science. I've watched it happen. And yes, every once in a blue moon, I'll get somebody who's super resistant. But for the most part, I'm able to decrease levels pretty significantly. And I did a whole separate podcast on and radio show on Vibrant Labs, and I might bring them back again. But Vibrant does a wonderful job with doing a ton of microbe testing and all the variants of Borrelia, all the Bartonellas, and they use basically genetic SNPs. So they're using gene coding and finding exact matches as opposed to running what we would call in our medicine guys a Western blot, which is just not a great test for what we need to do. But I do find that we can find inflammatory markers go down. I've even seen ANAs reverse, which is some autoimmune numbers with Biocidin. So again, when we talk about a bug challenging or even the gut disruption, you will see massive changes in a lot of, and actually liver functions as well. I have seen that too.
Well, it's interesting. You mentioned the HDL and LDL. We just ran, this is one of our pilot studies, which we're now trying to replicate. But we had 25 participants that did a before and after, took Biocidin liquid, as well as GI detox. That's our binding agent. I always recommend using both together, and we can talk a little more about that. But what we saw there in the before and after stool samples is let me back up for a second. Our hypothesis was we wouldn't see damage in the beneficials, and that's because we were using a layered botanicals there. And we were right in thinking that. We didn't see a decrease in the beneficials. So the lactobacillus was still up, the bifidobacteria was still up. What we were really surprised by and loved seeing was Akkermansia went up. And that is a keystone species, right? We can't really take a probiotic for it, but we want it because it's going to help diversify our microbiome. It's going to help with insulin sensitivity, and it's also going to help with our lipid panel. Mm-hmm. So I'm not surprised that you saw those also, come into range.
It's amazing what happens when you balance out the gut and the microbiome. And you're right to the point that you made about a lot of people believe that just a probiotic or oregano to cut down yeast or, will do the job for you just by itself. And I discourage that, to be honest, because taking those willy-nilly can absolutely, it can ruin your gut flora, right? Your microbiome can be completely destroyed. Whether it can be eliminated or you can create what we would call like a SIBO effect, which is increased bacteria in the small intestine that shouldn't be there. So basically you start feeding it, guys. So when you give the small intestine, the bugs that are in there, food essentially to live off of, and then they grow, you can get similar symptoms to what we would call a lower bowel issue, which isn't good either. So that is why I love this. And even topically, there's utility for this product. And I don't know if you guys do a lot of things topically. I have seen some of your protocols for wound healing and stuff, but I've used it on my dog, just FYI. So the fact that it came from veterinary medicine, I have a dog that has lymphoma that does not heal well at all. And I use it on her everywhere. So
yeah, Dr. Fresco definitely uses a line on her animals. It's not something that we really speak about because it hasn't been tested in that regard. But you can start to connect the dots for yourself too sometimes.
And all the things that are in there, I have looked up separately, to be honest with you, and perfectly fine for cuts and wounds, and So I've
definitely used it topically, a handful. LSF, I would say, is one of my more indispensable formulas that I'll have around. So even if I'm traveling, that comes with me. That and the throat spray, they always come with me where I go. And in fact, I was just talking to a colleague who got bitten by a horsefly, and she's like, "Oh, it's so annoying." We were in a meeting, and I said, "Why don't you just go put some LSF on that?" And she did. She put some LSF and she sprayed a little throat spray on it after, and she's like, "Oh, I feel a lot better." Yeah. But we've also seen it being utilized for a lot more serious issues. There was I think he was 14 or 15 months old, so really young population. We use it all the way from top baby, even infant, all the way up to elderly. We'll just change the serving sizes for them based on their weight. But there was a 15-month-old little guy who came in with mollusculum contagiosum. And for those who aren't familiar with that, it's a virus. It's essentially that it almost resembles like a chicken pox. You get a lot of lesions along the body. And so this little guy had over 100 on the front and back of his trunk. So really uncomfortable. It can take months to years for conventional medicine for it to go away. And in fact, in his case, there was no option because typically they burn them off. So too uncomfortable for this little guy. And in his situation, it was a case study for us because we didn't know if it was going to work or not. But we gave him LSF orally as well as topically. And by day 9, the parents were ecstatic. Day 30, we stopped the protocol. Yeah. And at that point, there was only hyperpigmentation left. So we've never seen that happen with mollusculum go that fast. So we were really pleased with those results.
Like I said, I've done it for warts. And again, it was a dog. But it's amazing. Similar to molluscum, massive amounts of them in our mouth, and they're just a suppressed immune system, right? So she just can't get rid of them. And if your body can't find them, they just grow. Yep. Like molluscum. And we did the same thing topically and orally, and it took a little longer than 9 days. But I will say that because destruction wasn't working, we tried. I should say, everything, and it just wasn't getting rid of them. Her body wasn't finding them. And within a couple of months, they were gone. So I think it was maybe like 45 days or so. And I mean, but there were thousands and thousands. I mean, they were everywhere.
Wow.
Yeah. So it was pretty impressive. So I'm a big LSF fan as well. So let's tell the listeners, what's the difference between LSF and the regular Biocidin?
Yeah, so exact same ingredients in terms of the 18 botanicals in there. What the difference is we actually take the Biocidin liquid, we ship it off to Quicksilver Scientific because they are kind of the leading edge individuals who make liposomes, and they turn our Biocidin liquid into liposome. So it turns into Biocidin LSF. It's a really small nanoparticle size. So we're looking at around 100 nanometers. So naked to the eye, we're looking at, I think I read 1/1000th of the width of a hair. So there's no way you can see this size. And so the really small particle size allows for intracellular penetration and absorption systemically into the body. So I like to use that one a little differently rather than just haphazardly putting it in the mouth where I use the liquid that way. The LSF, I'll actually do a sublingual delivery under the tongue, holding it for a good 30 to 60 seconds. And that way, a lot of it's going right into the bloodstream. Because of that small nanoparticle size, not all liposomes are made equally. So keep that in mind. The smaller, typically the more absorbable. And it's going into lymph and blood circulation. So now we are bypassing the GI tract. We're going to get some benefit in the GI tract. So I don't want to say you're going to get no benefit there because you are still going to swallow it a little. But mainly we're going into blood circulation, systemic lymph circulation. And then we even have the potential there to cross into the blood-brain barrier as well. So quite different than the liquid. If I'm looking at more systemic challenges or maybe some long-standing challenges, that's where I'll go for the LSF.
Yeah. And I would agree with you. I probably use 95% LSF. And primarily because I'm working on the gut as well simultaneously. And I know that the LSF will help me as well. And I'll put them on different glutamine powders and things as well to start calming the gut down at the same time. And then once they start getting better, I'll back them off and usually go over to the regular. So, and I'm a big believer. So let's talk a little bit about chronic infection, Lyme, how it can help, why it helps. And I think actually I am fascinated by why it helps. So maybe the studies show that it helps. Let's put it that way. Because I think thank goodness we have data, which is one of the greatest things about your company, I have to say, is that there's data to back most of this up. It's not just, anecdotal. There is, and like you said, it got shipped out unbeknownst to her at the time initially. And it really floored. I mean, Genova talks about it still. So the fact that they still talk about it is pretty impressive. So let's talk, I think there's 4 ways, right? Primarily that are 3-ish that we can help chronic infection, primarily, at least in my experience, Lyme and other co-infections that go with Lyme. And I would even venture to say COVID, because I've seen that as well, at least from my perspective, clinically speaking. So let's just start with adherence and then.
Sure. I would probably say there's 5 different mechanisms.
5? Okay, I'm looking at it. I need to recount.
I added some because I thought about it. So the first thing is the quorum sensing. So if any of your listeners don't know what quorum sensing is, essentially these organisms do something where they are communicating with each other essentially to find each other, where they can then build a colony. And once they have a large enough colony, they excrete that biofilm, which I was mentioning earlier. And it can have multiple organisms beneath that biofilm. So first things first, we cut down their communication strategy. They are no longer able to quorum sense, so they can't find each other. And there's a handful of ingredients in there. So the garlic, the oregano, bilberry, the golden seal in there are going to shut down the quorum sensing. Then we have the initial attachment phase. So if these organisms can't attach or adhere to surfaces, they can't create a biofilm. So that's the earlier part of biofilm formation. And a handful of the essential oils in the formula are going to inhibit that attachment phase. So now the antimicrobials, but so can your immune system, they more easily can go to work and get rid of these organisms. Once they get to that adherence phase, it's actually irreversible in terms of detachment, in terms of, rinsing or fluid going by. We then need to get more aggressive with how we remove biofilms. Swarming motility is another piece. I know you mentioned that one too. These organisms typically will grow flagella. So they get these tails where they can readily move around the body. hide out in different, crevices of the body, move around quite quickly away from an immune response. We sometimes even find, for example, we'll find spirochetes in the pit of a tooth. You're thinking, like, how did that even get there? But we're all connected, right? So we shut down the swarming motility with the grapeseed and the bilberry. And that way the antimicrobials, which are in abundance in this formula, can go to work. But I'm also a huge believer in our immune system. So not only are antimicrobials going to work at that point, but so is your immune response too. And a huge piece, I think, is the inhibition of the efflux pump. Yeah. So we are going to see reoccurrence of infection because typically biofilm is going to be an antibiotic resistance, the same thing with the efflux pump. So this is a drug resistance mechanism on the organism where essentially if something's coming into that cell wall that's aggravating them, damaging them, threatening them, they just pump it out. So they use the efflux pump to pump out any kind of harm there. And so if we shut down that efflux pump, Biocidin gets in, does its work. And if the practitioner is using it alongside other antimicrobials or perhaps even an antibiotic in some cases, that drug resistance isn't there because the efflux pumps is shut down. So we've actually even seen through our Borrelia research, we have some published research on that, where we saw the efflux pump shut down with the use of both the liquid and the LSF. So that was pretty exciting for us to see.
Yeah, that's pretty amazing. And I think, first of all, I think Quorum Sensing is just super crazy and cool, but
isn't it? I could spend hours talking about that too. I didn't want to go off on a tangent.
Yes, we're dorks. I'm sorry, guys. It happens in medicine and biology. But yeah, they literally talk to each other. So these chemo receptors and chemo censoring, and to block that is crucial. So I actually had a patient today who came to me as a post-COVID patient, and I have a lot of them right now. I do tend to do quite a bit of functional medicine in that part of the post-COVID world. But she wasn't getting better, felt achy, fevery, joint pains, literally couldn't get out of bed, would have good days and bad days. But this is a girl who would go out and garden every day, work out every day, very, very, very active woman. And I've known her a long time at this point. And interestingly enough, after everything she was telling me, and I started off on, the first thing I did, actually, we do silver as well. So I did silver and Biocidin LSF. We used a product we're going to talk about soon, which is GI Detox and Olivarex. But I also put her on a gut protectant. So we use something called Gut Shield or Gut Calm, which is a high-dose glutamine protocol. And did that while I was testing her for bugs, because I knew that there was something else there. This wasn't your traditional, especially her waxing and waning and nightly aches, right? So it was like every night fever aches, very consistent. And unfortunately, testing her through traditional mechanisms came out negative for Lyme. Testing her through Vibrant, again, interestingly enough, came back with 2 different types of Borrelia, which is Lyme, guys, and a species of Bartonella. And she had a mixed variety of IgGs and IgMs and C6 protein. So really, really what we would call alternative pathway positive. And put her on antibiotics. And she had described to me today, actually, in my office, how even despite trying to get rid of what we would call the Herxheimer reaction, which is what we use to stop the response of killing off the bug, which we'll talk about in a few minutes, she still got one, not nearly as bad as it would have been. And she had told me that as I'm literally reading her results of her Lyme positive test. So it almost gave me the diagnosis without knowing it, right? And I love that, because how amazing is it that I was already stopping the biofilm? I'm already stopping the Quorum Sensing. I'm already stopping the efflux pump. So now I can effectively, hopefully, get her on antibiotics and get somewhere.
Right.
And then keep her on the Biocidin and keep her on the silver for quite some time to try, again, that waxing and waning protocol, because it unfortunately doesn't, at least as far as I'm concerned, once you're at a critical threshold, it doesn't completely go. But, get it to a point where she's completely functional, and we can kind of go forward. So I think that's really interesting. And to your point, yes, we need antibiotics sometimes for sure. But I've equipped her body and her immune system to now help me eliminate this. And that's what I love about it. So that's my little tidbits for today. But the tetracyclines, the macrolides, the quinolones, the cipros, they work better when you're able to get them into the cell, into the microbe, if you can't get through that biofilm, I think I look at it like one of those plastic bubbles that you used to blow through the, they were like little air bubbles and they looked like plastics.
Oh yeah.
Ball. That's what I think of biofilms like. It's like this plastic circle that surrounds you. And if you can't get into that, all you're doing is maybe killing a couple free floating, spirochetes or microbes. And then it's just sitting there until they get together and they talk and they build and they make themselves present. So, I love it, and you don't have to sell me. So we're about the 38-minute mark. So I'm going to kind of probably talk a little bit about yeast, maybe, because I think this is a really big one. I've also used it for chronic UTIs and yeast infections in women. So I actually liked this little blurb that I had come across in some of the research. So let's talk about yeast overgrowth and how it works.
For sure. So we do have a lot of pilot studies showing the effectiveness of Biocidin with Candida albicans specifically. Yeah. And I want to back up for a second and piggyback on something you said a lot earlier. You're talking about SIBO.
Yeah.
And so when a lot of people are addressing SIBO, they're using antibiotics or antimicrobials. But if they're not in a nice synergistic balance, you sometimes develop SIFO. You've gotten rid of the bacterial overgrowth, but you've left so much space and you've gotten rid of so many of your beneficials that now we start to see an abundance of a yeast overgrowth.
Yep.
So I see that happen all the time, and that's really why I like to use a balanced formula like this, because we don't see SIFO being developed when we're addressing dysbiosis. In fact, we sometimes use Biocidin when there's a fungal presence there. And so one of the things that I love about Biocidin is it will help, decrease that yeast overload, but we're not damaging our beneficials so that the yeast does not continue to grow and proliferate. One of the other things, and I don't think we talked about it previously, we were, talking about a few of the products. I didn't mention Biotonic, and it's not something that you had talked about, but it's I love Biotonic. And the reason why I want to talk about it for a brief moment here is it contains Artemisia, that sweet wormwood. I love that for a few things. It's antiparasitic itself, but it also will help retard the hyphal growth in yeast. So with Candida, it can develop its own biofilms and it will have a budding. So it gets the daughter bud and then it starts to have these hyphal, almost like tentacles that penetrate into the tissues and make it really difficult to eradicate. So I love bringing Biotonic as an additional support there too to stop that. But certainly with the yeast overgrowth, we've seen that being diminished as well with Biocidin because of the handful of antimicrobials in there. I will note, and I don't think I said this eloquently enough earlier, is Biocidin seen as a broad spectrum antimicrobial. So not only is it going to address bacterial overgrowth, it's also going to address fungal yeast overgrowth as well. And then in some cases, with the Borrelia research, we're also seeing it support and address some viral concerns as well.
Yeah, I think, and actually, I did not know that about the Biotonic and Artemisia, so that is going to be on my new list after we get off of here. I'm a big Artemisia fan, especially, again, for my Lyme patients, too, and keeping their, one, it's great for penetrating biofilms as well, but for keeping their natural yeast in check, it's phenomenal. So,
that particular one actually is it's an adaptogenic blend, so it's really been more designed for supporting digestion and fatigue, which often is one of those symptoms that come along with those Lyme patients, right? So it's a nice one to balance. So not only are you going to get the retarding of the hyphal growth, but you're going to get a little balance of the HPA axis as well along with that.
As well. Gotcha. But so guys, Biotonic, maybe my new one on my website, so look for that as well. So you just brought up, that was actually going to be my next point, was the broad spectrum. So I think that's really important to understand that it doesn't treat one thing, right? We're talking about so many different things. We're talking about yeast, we're talking about bacteria. And I'll just put in there, and again, I can talk about this because I'm using it anecdotally and clinically. I have found it to be really successful with COVID exposure and even my post-COVID patients. So I'm of the thought that post-COVID patients are 9 times out of 10, when they're not getting better, they have two things going on, and they see this almost always. They have a gut that's already disrupted before they get infected, and they did not realize it, whether they had symptoms or not. It doesn't matter. So they actually get new digestive symptoms. And that's almost every single patient, I have to say. So almost like the lack of digestive enzymes. And to a point where it's they can't really eat. And the other thing that I'm seeing is reactivation of infections that have already been sitting there. And I think that's really key. You know, when you see somebody that is having these symptoms that they perceive to be continuing, it might actually be a recurrence or a reactivation of a latent virus or microbiome. And that's what I'm seeing in almost everybody. Now, could COVID still be sitting there? I'm still of the thought process that possibly yes. I'm not convinced that it's eradicated completely. I guess that remains to be seen, and we'll see. And again, I'm not trying to put any ideas out there, but I can tell you that in almost every case, this is someone that already has leaky gut, that already has immune dysfunction or autoimmune issues, and almost always has a microbe that has been reactivated or underlying. So again, one of my top lines, Biocidin and silver are two that I just kind of, almost everybody start on it because it's so awesome. I use mostly LSF, I have to say, because I love the delivery system, although it does taste like Christmas trees, but sorry guys.
I haven't heard that one. I've heard sweet pizza, Christmas trees. Okay.
Oh, it's absolutely. You taste I guess it's almost like a eucalyptus flavor. It's very Christmas tree. Like it's probably the bilberry in it, to be honest. But yeah.
I should get a book of people's descriptions. I should, start creating that. What does it taste like for you?
It's pretty bad. It's okay. You get used to it, actually. I have to say, it's one of those things where in the beginning it really bugged me, but now it doesn't bother me at all. So,
I've had one male patient not enjoy the taste of it. Other than that, I have not had any issues with it.
Yeah, I mean, I think with kids it's a little bit of an issue, but because I've used it in kids too, and they don't love it, but it's not terrible. It's
Gummy Bears. I've been making gummy bears with Biocidin. That's my trick.
What, you put gelatin in it?
Yep.
Oh, all right. So this is what we're doing over the weekend, guys. Oh, not this weekend. Next weekend when I get back. All right, that's going to be our trick. We're going to put that on YouTube or something. We'll do it. We'll make it online. All right. So let's talk a little bit about the other products so that go along with kind of Biocidin and how they work together. And I think this is really important because I actually think a lot of docs miss the boat on this. You just go to treat and, again, hit it with antibiotics, hit it hard, but we're not doing anything to make the patient feel better or necessarily help them to get the bug out of their system. These are people whose livers don't work, their guts don't work, we're not absorbing things, so they're all junked up, right? So
it's, for sure, I should put out there, you can use this line with other products too. So if you're working with somebody who's not able to digest, get them on some digestive enzymes, support their body that way. You had mentioned earlier with your post-COVID patient, she was having some Herxheimer reactions, right? GI detox. So you want to use a broad spectrum binder. Probably when I'm consulting with practitioners and they call in and they talk about these reactions, I ask, what are they using to bind? Often it's nothing, or it's a solar binder. So they're just doing activated charcoal, or they're just doing spirulina. And I'm like, well, again, there's a layering effect, right? So GI detox contains, what is in there? MMST silica, which is a binder itself, right? Then we've got some activated charcoal, humic and fulvic acid, which is lovely for that pesticide absorption as well. And regardless of how clean we eat, we are exposed to it. Then there's some apple pectin, a little bit of aloe. I feel like I'm missing one. Oh, zeolite clay.
Zeolite, yep.
So all of that is packed in there. There's a little bit of aloe in there too, because all binders, regardless of where you get it, who you purchase it from, they can have a drying effect. So two things. Make sure you're hydrated. Extremely important anytime you're trying to do any kind of detox protocol or any protocol in general. Like, you need to be hydrated. And when you're taking a binder, that too. So I like people to follow it up with a full glass of water. That's typically how I recommend it. But there's also a little bit of aloe in there too to help offset that drying effect. So certainly can be something titrated to tolerance as well. Usually I'll do 1 or 2 caps, but there's some random cases. I was working with somebody who was mold compromised, and she wasn't able to get out of her living situation yet. So we had her on a lot higher of a serving as well with that. So you can play with it depending on your need.
Now, do you recommend doing it a couple of days or weeks before you start Biocidin?
I've had that question a few times. I don't think it hurts. It's not necessary in all cases, but if there's some individuals with a really high toxic load, I don't think it would be harmful to start off with that. In fact, those who are really sensitive and have those really severe Herxheimer reactions typically are Lyme mold patients. Those who have infections going on, starting off with a binder, or sometimes I even like to start them off with biotonic, just to give them a little bit of vitality, to bring up that force for them.
Fix the adrenals first. I'm with you on that a lot of the time.
So bring in those two if they're really sensitive individuals. Otherwise, I'm fine with starting off with Biocidin, because you can titrate it. So you can go 1 drop, or if it's the LSF, you can do 1 pump. If 1 pump's too much, you can dilute that in water. There's so many ways of titrating it so that you're able to tolerate it. I'm not one of those practitioners that pushes people through a Herxheimer reaction. We want to make sure that they're still comfortable and they're still going to show up next week or next month to continue their protocol. So let's work with the body. So supporting the detoxification pathways also. Biotonic, I didn't mention this, but it will help support lymph drainage too. So if our drainage pathways aren't open, we're going to have more of a Herxheimer reaction as well. And that will lead me into Olivirex. So Olivirex is another, I'd say it's a really potent antimicrobial on its own right. So it's packed full of other antimicrobials. It's a nice option if somebody has a nut allergy. So if they can't take the black walnut hull or leaf, then Olivirex might be an alternative for them. I will also use Olivirex alongside Biocidin in those situations where it's a long-standing, situation, really complex, multiple co-infections going on, a lot of gram-negative, definitely methane-dominant bacteria. Olivirex comes in as well. Oleoprin is one of the main ingredients in Olivirex, so that's olive leaf extract. And very easily you would find in the literature that it's antiviral. So it's something that I actually use for seasonal support. And I don't see, I wouldn't disagree with you in terms of how you brought it in for your post-COVID patients, because again, it being antiviral can be supportive in some regards. I will say Biocidin has not done any research on COVID yet. So only from our own experiences are we deducing this from, no claim from the company, but it's something I used when I got COVID. It was part of my protocol was the Olivirex, the LSF, the GI detox, and a ton of course, Proflora, because of the quercetin in Proflora. So myself and my husband came out pretty great. So I'm really grateful for that. But I think it's because we really supported our immune health prior to, but also when we actually contracted it as well.
Yeah. So yes, agreed. Obviously, I can't make any claims, guys, but I will tell you, like I said, from a clinical perspective, and what I do, and people look to me for non-traditional answers. And from a science perspective, it makes sense. And it's going to just make you healthier. That's the bottom line, right? There's so much to it that's just going to improve the way you feel and the way that your body responds to things, specifically when it's taxed by an infection or a bug. So I do love Olivirex. So the question that someone asked me the other day is, why can't they just eat olive oil? I literally got that question. So I think it's important to talk about the potency and the purity of I can never say the oleoprin. So
it's a very high grade oleoprin. It's coming in around 18 to 24%. In fact, Dr. Fresco designed Olivirex for herself.
Okay.
So she had Epstein-Barr virus and she was using oleoprin to help support her body in that way. And she was taking it from another brand, but the potency wasn't there. So she said, I was like taking 8 or 10 capsules. It was some ridiculous amount each day. And so she met a farmer who sourced this really potent oleoprin, and then she blended it with some other botanicals, as she normally does, true to her fashion, and came out with this formula. It's great, not only for being antiviral, antimicrobial, but also it has a bunch of botanicals in there that are going to channel toxins to the bladder and to the bladder, so that way we can excrete them. It's also going to help with your kidney drainage too. So it's a beautiful formula in that regard. It's not one that I use with young patients because if they can't swallow capsule, that I would say is not a nice tasting formula.
Yeah.
So take it in your capsule if you can. I actually have used it with one little girl. I think she was 7 years old, and she had come in with she had the herpes simplex virus. So she had come out with an outbreak on her lips. So we did topical application of LSF oral as well. And then she was really brave and took the olive RX, half a cap AM and half a cap PM. And we put in a little bit of hazelnut butter and honey, and away she went. And 3 days later, cold sore's gone. 5 days later, we stopped the protocol. So very quick and easy for her. But I would say most kids are probably not going to grab onto that olive RX unless they can swallow the capsule.
Yeah. I've tried it. I wouldn't even take it.
It's bitter. It's extremely bitter. I was so surprised that this gal was doing it. And I was like, okay.
But I do the capsules. I mean, the capsules are wonderful.
Mm-hmm.
So actually, you brought up a product that I didn't put on our list. So maybe we can just touch on the Proflora.
Sure.
So, and I have to sneeze. I'm sorry, guys. So I actually did not remember that it had, you just said it, but I can't remember.
Quercetin.
Yeah, quercetin in it. And I love quercetin for histamine reactions too, and cutting down the inflammation from allergen spiral, if you will. So tell me a little bit about that product. It's something that actually I've used in the past in the office. I have not carried it on a regular basis, and I would love to tell my listeners more.
Sure. Yeah. So it is, it's a probiotic, and it's a spore-based probiotic. I don't want to scare people off with that because there's some confusion between soil-based and human-derived. So this is a human-derived spore-based probiotic. In fact, we partner up again with one of the companies that does it best, and it's Microbiome Labs. So they are very kind of, I'd say maybe not the forefathers, but they've done a lot of work in terms of spore-based probiotics. So we licensed 3 of their spores. We've got the Bacillus subtilis, coagulans, and clausii in there. The difference between a spore-based probiotic and your conventional probiotics, like a lactobacillus species of such, especially if your conventional ones aren't enteric-coated, about 3% of it makes it into your large intestine. That's a very small amount. So some people, when they see ours, they go, oh, well, you only got 3 billion CFUs. That's a lot. And the reason why it's a lot is 99% of that actually makes it into your intestine. So you're getting all of that where you want it to go. And then, like you said, that quercetin, I love using it for histamines. So if there's any kind of mast cell activation response going on, certainly I bring in Proflora. You can bring in additional quercetin too if you'd like. And then it also has some marshmallow and aloe akin, really soothing to the mucosal lining of your GI tract. So we're trying to plump up that mucosal lining. That's another defense for us, so we don't have those that leakage through the gut pathway and getting those antigens through, and then we start seeing immune response. So not only is it going to help to proliferate the organisms in our gut, but we're also soothing that lining, which is really key and important. And one other thing I will note about spore-based probiotics, especially these 3 that I've looked at, these 3 species more specifically, is they actually produce their own antimicrobials. So not only is it a probiotic, now it's also an additional layer of an antimicrobial. So pretty cool in that regard. And they last a lot longer in the system too, not damaged by stomach acid. They don't need to be put into a fridge, so you can easily travel around with them. Really, really versatile. And I will say also, most people tolerate them really well. So for some folks with dysbiosis, especially SIBO, they usually don't tolerate a lot of probiotics all that well. And so this was one that you can titrate if you need to. You can open it up. All of our stuff can actually be taken out of the capsule. But that hasn't been my case. I haven't had to titrate it for anyone yet. But it is something that I will advise other practitioners of if they come across that.
Oh, interesting. So everything that we've taken out of your capsules too, nothing's extended really good. So everything.
Nothing.
Up. So I get that question quite a bit, to be honest. I have a lot of patients, especially with what I do, that just quote unquote, they're very sensitive to medications, right? So even if I don't want to titrate them up in a certain way, they want to titrate themselves, which that's good to know, because then we can split these up. We can put it into a smoothie. We can do something to make it a little bit more, a little smaller dose and more palatable for a patient. So definitely.
And that's also why I love using it with kiddos.
Yeah, it's amazing. So I'm going to briefly tell you guys my story. We have about 4 minutes. So I'm going to give you my story. And so for those of you who don't know me, I'm pretty active. I've done an Ironman. I've done some halves. I'm a little bit crazy sometimes. So I love to train. I do a lot of training. And I had hip surgery about 4 years ago and started to come back from hip surgery after I had completed an Ironman and another half, and then did a half marathon and went to Brazil. So my honey was doing an Ironman in Brazil, and I had a rash there that I did not realize at the time was going to be Lyme, because my whole leg was red. And I did not think that it was Lyme, but because it was just, my whole thigh was just a big circle. And I came home and I had taken prednisone when I was away because my red leg was hot and annoying, and that was probably the worst thing I could have done. And I got home and I was not getting rid of my jet lag. That was my theory, right? So I was exhausted. I was tired all the time. I was achy all the time. And then fast forward about 8 weeks in, I started getting some blurred vision and started to the point where I couldn't think. Like my brain was so foggy that when I was at work, it was almost like I was talking like Charlie Brown's teacher. So I could hear myself like, wah, wah, wah. Very, very bizarre, to the point where I would talk myself out of running outside. And this is going to sound very strange because I was afraid I couldn't get home. Like the very, very bizarre, not normal thought processes. I am not an anxious person. So anyway, I went and drove my labs, thought maybe it was my Hashimoto's, maybe it was, something else, my testosterone, and went and got a doctor to get me an MRI because I thought it might have been MS at the time, and put a Lyme on my labs last second. Just literally threw it on my Western blot with a regular lab. Lo and behold, my Western blot came up positive with 4 out of 5. Now, I didn't have 5, but I had 4 positive bands. And, I ended up getting a Vibrant lab test much, much, much later. But so I started treating myself. And at that time, I was having a lot of neurologic symptoms. So I think that what I can tell you from experience is the brain thoughts that I was having and the weird, I'll never forget the thought process that I was running, 16, 18 miles at a click, and to think I couldn't go 3 miles because I wouldn't be able to get home because I'd be too tired was ridiculous. So the thought processes were so strange that I really didn't understand where that was coming from. So I think that that's really critical to understand that when I started, I did an antibiotic regimen. I'm just getting some questions, guys. I did an antibiotic regimen and I did all these things. And I have to tell you, I wasn't better. I did a round and a half. I did almost 60 days of Doxy. Internationally, Doxy is, we do it they actually do it up to 6 months international. I'm sure in Canada, I know it's different than the United States. It's 21 days here, which is insane. Mm-hmm. It just doesn't even touch the envelope. It's the tip of the iceberg, but I was not getting better and I wasn't tolerating the Doxy very well. So I would get sick. I'd feel achy. I'd feel terrible. So actually that's when I started to find Biocidin. So I had already started myself on silver. So colloidal silver, same company that you guys get your microparticles, nanoparticles from. And I started the silver. I started a quintessence protocol, which is a protocol I learned way back when from, oh goodness, ages ago. And when I'd started that with artemisinin, so Artemisia, quintessence protocol, Biocidin, and silver, I finally started to feel improvement. And I weaned myself off the Doxy after a while. And I've been on gut protocols for a long time. So just so you guys understand, I have leaky gut. I've been on all these things forever. I have reflux. I have autoimmune thyroid disease. My mom has RA, and I've positive ANAs for years. So I'm kind of that perfect candidate to have Lyme that just doesn't go away. So I do have good and bad weeks. I've been good for a while until honestly I got my COVID vaccine, and honestly I have not felt up to par. So I will say that, but again, it's that wax and wane. So I went back on my Biocidin more frequently. Same thing with the GI Detox and the Oliver X. I'm back on both of those, which I've been off for quite some time. So, and I'm starting to feel better again. So it is that kind of, all right, those bugs got me and they made their biofilm again. They started to kind of creep back into my life and we just have to put them down again. So that's kind of my crazy story. Not as bad as not being able to use my hands, but I couldn't use
I don't know. That's still pretty bad. Fatigue. I have a family member with Lyme too, so I see it, and it's debilitating.
It is. And I will say, and then we have about 2 minutes, I will say that I have seen both sides of the spectrum. I've been a traditional physician, so I was a family practitioner by trade, and I came into this, and I will tell you, I thought that people that talked about this stuff were crazy, right? Because really, how could this be normal? And then you meet people and you learn how to get them better and all these things, and you realize, wow, we're missing the mark with medicine. And that's actually why I started doing this, because it totally was missing the mark. I got sick and I was allergic to all thin-skinned fruit. And that's actually what made me fall into this whole thing after I had my baby. So again, we're wrapping it up, guys. I think we have about 30 seconds, but I think what you need to understand is that, and you can probably agree with me, traditional medicine, unfortunately, we've gone so far right and so far left. We've really missed the mark in both ends, I would say. And there's so much in the middle that we have to offer, that you don't have to be stuck with these symptoms that are unexplained by traditional medicine. And I hope that Biocidin is one day traditional medicine, to be honest.
Me too.
So, on that note, I'm going to close with saying, Alia, you're amazing. You can come back anytime because we would love to hear you talk. You've explained things very, very well. So whenever you want to come back, we'll talk about lots more. And
I'm all for it.
Yeah, and we can get all these products on mydrlori.com. And it's mydrlori.com. And if you have any questions, just shoot me a message. I will forward them to Alia or myself so we can get sorted. All right, guys, have a great evening, and I'll talk to you next week.
Thank you for tuning in to Anti-Aging Unraveled. Be sure to join Dr. Lori Gerber again next Wednesday at 3 p.m. Pacific Time and 6 p.m. Eastern Time on the Voice America Health and Wellness Channel. We'll talk again next week and keep you aging gracefully.